the rise of a game-changing ingredient for seniors. In the world of health and fitness, there's a prevailing belief that building muscle, especially in older adults, requires consistent exercise. Aerobics, weightlifting, resistance bands. These are seen as key to maintaining strength and muscle mass with age. But what if I told you there's a single, natural ingredient that can rebuild muscle in seniors, even without conventional exercise? That's right. No gym, no equipment, just one powerful compound that taps into your body's own regenerative capacities. Throughout my career working with older adults, one pattern kept emerging. The majority struggled to sustain exercise routines, joint pain, chemotherapy after effects, arthritis, chronic fatigue. Life often constrains daily movement, but the consequences of inactivity are serious. Loss of muscle mass, rising fall risk, metabolic slowdown, mood decline, fatigue. Research labels this insidious process sarcopenia, age-related muscle wasting, which can begin as early as the late 30s, accelerating after 50, and compounding by 70. But what if there were a way to spark muscle regrowth even without formal exercise? A way to turn back time on muscle atrophy and rekindle strength from within? The answer lies in a natural compound that's been under our noses all along, an ingredient supported by decades of clinical studies. What makes this ingredient so revolutionary? Bioavailable, easy to absorb, readily used by your body. Hormonal, synergy, offers gentle anabolic, muscle building, signaling without harsh endocrine imbalance. Muscle fiber protection, shields fibers from breakdown. Efficiency, just one small daily dose. Safe for seniors, minimal side effects, no prescriptions required. In this 4-part series, we'll explore the science, what the ingredient is, how it works at a cellular level, and why it's validated by research. User experience, real world, stories of seniors who've regained strength, mobility, and vitality. How to use it, best forms, daily routines, dosage guidelines, and how to pair it with nutrition and gentle movement. A holistic plan, incorporating this ingredient into a simple lifestyle system designed to maximize your functional age and performance. Part 2. The science behind the ingredient. Science has always pursued ways to preserve and build muscle in aging individuals. Recent breakthroughs have shed light on natural compounds that boost muscle protein synthesis, without relying solely on exercise. Among these, one stands out: HMB, V-hydroxy V-methylbutyrate, a metabolite of the essential amino acid leucine. What is HMB? HMB is produced in trace amounts during protein digestion. In the 1990s, researchers discovered that supplemental HMB, typically 3 grams per day, could accelerate muscle repair, reduce breakdown, and boost strength gains, even in untrained populations. How does HMB work? Reduces muscle protein breakdown. HMB inhibits the ubiquitin proteasome pathway, the body's main muscle protein degradation system. A 2000 study in older adults showed HMB reduced muscle wasting by around 40%. Stimulates muscle protein synthesis, MPS. It activates mTOR, a master regulator of muscle growth, via leucine pathways, upregulating protein production in muscle cells. Enhances satellite cell activity. Satellite cells help repair and regenerate muscle fibers. HMB boosts their activity, improving recovery and muscle remodeling after microdamage, even with gentle movement. Improves mitochondrial function. Muscle aging often involves declining cellular energy production. HMB supports mitochondria health, improving endurance and stamina at a cellular level. Clinical trials and evidence. Older adults, 65 plus, sedentary. A 2003 double-blind trial showed 3g HMB per day for 8 weeks, increased lean body mass by 1.5 kg and strength by 10 to 15% without prescribed exercise. Bed rest study. Seniors confined to bed lost far less muscle over 10 days when supplemented with HMB, just 2% loss versus 4% in the control group. Chronic illness populations. Cancer, cachexia patients on HMB maintained appetite, improved body weight, and better quality of life measures. Meta-analysis outcomes. A 2018 meta-analysis of 14 studies involving older adults confirmed HMB increased muscle mass, mean gain 0.24 kilos, and reduced fat 0.4 kilo in 12 to 24-week periods. Safety and tolerability. HMB has an excellent safety profile, even with extended use. Adverse effects. Rare. Mild stomach upset, gas. No effect on hormones or blood pressure. No drug interactions noted. Safe for seniors, even those on most medications. In short, HMB offers a clinically backed, non-prescription way to help seniors regain or maintain muscle mass, even when exercise isn't possible. In Part 3, we'll share real stories of how seniors have used HMB to reclaim mobility, confidence, and purpose. Part 3. Real-world stories. Rebuilding muscle and life science paints a compelling picture, but stories bring it to life. Here are real experiences of seniors who transformed their bodies and vitality with HMB supplementation. Margaret, 72, the struggle. Post-hip fracture recovery left her weak, fearful of falling, and dependent on help. The solution, 3G, HMB, towered on top of hospitalization smoothies and foods. The results, within 4 weeks, she regained walking independence. At 12 weeks, she'd resumed dancing and gardening. She gained 1.8 kilos of lean mass and reported improved stamina and posture. George, 68. The struggle, sarcopenia from chemotherapy, caused persistent leg weakness. Physical therapy brought limited gains. The solution, added HMB to his daily supplements without changing his activity. The results, he regained upper body strength, lifting a grocery bag and walking the park. Trail, muscle thickness improved by 5% via ultrasound. Frau. Sandra, 65, the struggle. Severe osteoarthritis limited her to minimal walking due to knee pain. The solution, started HMB with hydrating green shakes and joint care. The results, mild walking routines, became easier, allowing daily mobility. Within 8 weeks, she built calf and thigh muscle. By 12 weeks, she resumed gardening with confidence. Key takeaways from their journeys. Minimal side effects. High enthusiasm. Even light physical movement. Gentle walks, yoga, simple weight-bearing tasks enhanced HMB's results. Even without formal exercise, HMB helped seniors regain functional strength and confidence. Part 4. How to use HMB and support your muscle health plan. Form and dosage. Standard dosage, 3 grams, 3,000 milligrams of calcium, HMB per day, often in 1.5 pangs doses with meals. Alternative is 1G free-form HMB only once a day. Timing, with meals or post-meal for better absorption. Duration, safe and effective for extended use. Clinically studied up to 24 weeks or more. Choose high quality. Products. Look for USP CGMP certified brands. Prefer bovine-free options. Check for purity and third-party testing. Pair with supportive habits. Hydration, 6 to 8 cups of water daily. Protein intake, at least 1.0-1.2 g/kg body weight daily. Lean meats, dairy, eggs, plant proteins, legumes. Gentle movement. Daily walks, chair squats, stretching, or Tai Chi improve nutrient flow and reinforce results. Optional add-ons. Vitamin D, 1,000-2,000 IU, and calcium, 500 and 1,000 mg, for bone support. Omega-3s for anti-inflammatory and insulin sensitivity benefits. Creatine, 2 g/day. Further enhances muscle strength and recovery. What to expect. Timeline, timeframe. What to expect. 2 weeks mild energy boost. Improved recovery from simple movement. 8 Weeks, notable strength gains, standing from a low, chair, climbing stairs, reduced fatigue. Weeks, clear muscle regrowth, 1-2 kilos lean mass, better posture, mobility, 4 plums. Weeks, long-term maintenance of youthful muscle mass, resilience, independence. Track your progress. Measure. Body weight. Twice weekly, same time, same clothes. Functional test. Sit to stand test. Count how many reps in 30 seconds. Mood and energy. Daily journal. Note improvements. Professional check-in. Periodic evaluation to confirm muscle gains via ultrasound or DEXA scan. Common concerns answered. Is it safe with my medications? Yes. HMB has no documented interactions with cardiovascular, diabetes, bone, or psychiatric meds. Confirm with your healthcare professional. I'm frail. Can I still start? Absolutely. Frail adults benefit most. HMB helps maintain muscle. During illness, hospitalization, or surgery, should I exercise? Minimal gentle movement accelerates results, but even without it, HMB supports muscle protein synthesis. Think of it as the foundational fuel your body needs. Movement enhances its use. Your 10-minute daily strength plan. Morning. Drink HMB plus protein, milk, espresso, or plant protein. Mid-morning. Gentle stretch or walk. 1-minute chair stand test. Lunch. Protein-rich food, plus good hydration. Afternoon. HMB if dividing dose, optional gentle walk. Dinner. Protein meal, plus hydration splash, 8 gals p.m. Evening. Optional 5-minute stretch to support flexibility. Final thoughts: older adulthood isn't a slow fade. It can be a second spring of strength, independence, and energy. Research shows that 3 grams of HMB daily, integrated into a lifestyle of proper protein, hydration, and gentle movement, can rebuild muscle even without traditional exercise. Whether you're recovering from injury, living with chronic fatigue, or simply want to defy time, this protocol puts age-proof muscle back within reach. If you're ready, start today. Choose a trusted HMB supplement, set reminders, and kickstart your journey towards stronger, more vibrant living. Your future self will thank you.